name's Matt Reeves. I'm the Chief Medical Officer at WomanCare Global. So 2 weeks ago, there was a technical consultation on hormonal contraception and HIV. Last July, a study was published suggesting that Depo-Provera increased the risk of HIV transmission, both from a man to a woman and the woman to the man. And so the WHO convened this meeting to discuss the evidence and see if any changes were warranted in their recommendations for the use of hormonal contraception where HIV is common. There were about 80 attendees from all over the world. Most of the attendees were either from Africa or worked in Africa. A colleague of mine who's at the WHO, Maria Rodriguez, created a decision analytical model to examine the competing risks of new cases of HIV versus the risks associated with pregnancy if there was a change in contraceptive use. I helped her with the model. There were three of us, Aaron Coy, Maria, and myself. We used this model to assess what would change if Depo-Provera were removed, assuming that Depo-Provera does increase the risk of HIV transmission. What we found was that even if you assume that Depo-Provera doubles the risk of HIV transmission, removing it creates more harm than good in most situations, because in most areas where there's a high risk of HIV transmission, there's also high maternal mortality. So if Depo-Provera is removed, in most situations you're going to have a much higher pregnancy rate and many more women dying of pregnancy-related conditions. We spent a lot of time talking about is the fact that much of sub-Saharan Africa is very reliant on injectable contraception, and that there's really a need to diversify the method mix that's used. One of the big problems that our model pointed out is that if you remove Depo, there's a big hole, and you'll have large numbers of women without any method to use. The most common other method is pills, which have a higher failure rate and are also logistically harder to deliver. So we really need to diversify the method mix and introduce more options, including contraceptive implants, copper IUDs, sterilization, permanent contraception is also an option that is not widely available. So introducing some of the options that WomanCare Global provides will help diversify that method mix and reduce reliance on one method.